Hey, everybody. Welcome to Ignite Healthcare Marketing Podcast. My name is Leone. I am the Chief Growth Officer here at Cardinal. And today I have with us an amazing guest. I had the pleasure of meeting Lindsey Kratzer a few weeks ago. We were discussing just healthcare marketing and exchanging passions. Lindsey is the CEO of Spark Health Advisors. Lindsey, your group specializes in B2B2C marketing, which is just an extension of kind of what we do here at Cardinal. So wanted to bring you on as a guest because I know a lot of our listeners and clients have their direct to consumer functions, and then they have other work streams where they may be building direct to employer programs, they may be building worksite programs, they might be building provider referral programs. So I think bringing some helpful advice to the table for all of our listeners in these other areas is something that we wanted to do. So thanks for joining us.
Thanks so much for having me, Lauren. Appreciate it.
In this episode, I want to make sure we get a chance to touch on kind of the challenges that these organizations, both digital health and clinic-based groups, are facing in reaching businesses in the B2B side, and then also in reaching consumers, and how we can help them to develop and implement these successful land and expand strategies. So, Lindsey, I think it's first helpful to just hear direct from you. Tell us about Spark Health Advisors. Tell us about what you do in your experience.
Yeah, absolutely. So my expertise is in the employer space. As you mentioned, Lauren, really working with a B2B2C audience. So with Spark Health Advisors, we are a growth advisory and consulting firm that works with healthcare companies that are looking to win more employer clients. And I think that we're kind of unique in that we can do the advisory work, but we can actually do the tactical down and dirty work as well. So what we've found as we've been doing this is that many companies need help from a go-to-market strategy development perspective, but they also need somebody to stick around and actually help implement. So we offer sales, marketing, and sales operations implementation services as well. And I think that that's really added a lot of stickiness to our clients over time.
And talk about a typical client for you, just to kind of, what
Sure.
verticals do you work in, size wise, just to kind of anchor as we get into this discussion on some of your experience and the problems you're used to solving.
Yeah, absolutely. So we tend to work with companies that are backed by venture capital or private equity. So typically, anything from kind of early stage, seed stage companies all the way towards larger growth stage companies that are kind of actively perhaps revising their employer strategy. Most of the work we do is with digital health businesses, but we also do a ton with clinic-based businesses. I have a background in primary care, and my partner has a background working largely in digital health as well. So it's really kind of a nice complement that we bring together. But yeah, we work with businesses kind of all sizes, but generally those that are looking to actively grow within the employer space.
So let's dive right into that. Talk about that space specifically. What are some of the nuances and challenges that are coming up that you're solving for? Like your typical, hey, let's have a discovery call. I want to talk to you about this challenge. I see you advise there. Like, what are you hearing? What are people up against?
Yeah, absolutely. So, I mean, I think that, a lot of companies that we work with are looking really to like win more employer clients to start with. So they are looking to build a robust pipeline. They're looking to move deals through the pipeline a little bit faster, oftentimes to close opportunities ideally for the next calendar year. But then they also need a longer term strategy as well. And I think when we get into kind of the marketing piece and the B2C piece, I think a lot of times, companies may have been successful working with health plans or other audiences, but when you start working with employers, it's really a totally different group in trying to get to employers and then ultimately the employees and their families who are the actual people who are consuming the healthcare can be, really challenging. So it's really kind of a nuanced audience that we really specialize in. And we find that there's a lot of value in helping companies really, figure out how to best go to market within the employer space.
So what are some of the pillars? Let's talk employer first. You've got to land that before you're obviously going to get those consumers. So that relationship is kind of the leading piece. What are some of those pillars? I mean, are you guys building messaging strategies? Are you helping with CRM and nurture sequences? Like what are some of the big pieces that you find that you can most help with?
Yeah, absolutely. So a lot of times we come in first and we do an assessment so we kind of understand where we are from a current state perspective. So, taking a look at existing pitch decks and materials, understanding the product, things along those lines. And then we typically build a specific strategy for the client. but a lot of time it starts with the messaging and the value prop. So making sure that they really have a targeted, dialed in value proposition that speaks to the problem, not only for the employer, but also for the patient or the employee as well. And that they're really addressing that. And I think another thing within the employer space is that it's just a very like matrix, like complex space to sell into anymore. And there's a lot of influencers. So I think that it's important to help companies understand, the roles of brokers and consultants, or the roles of TPAs, or some of these other groups that are playing in this space. There's also been the kind of an explosion of a lot of aggregators in the space who are really kind of consolidating a lot of these benefits for the employers as well. So we do a lot of work with helping companies kind of navigate and figure out what's going to be the most effective way to go to market to actually reach the ultimate employer.
Do you have, this is just kind of a question I have, seasonality in all of this? What is kind of the timing? Like if someone is looking at adding or landing a new employer contract for next year, when should they be thinking about this? Like now, 3 months ago? Like is there a
Yeah.
deadline? How late is too late to help them with that? And do you hear a lot people coming kind of down to the wire?
We do, yes. We certainly hear about people coming down to the wire, but then they're also starting to think about the following year. So seasonality is absolutely a big deal within, especially kind of the large self-insured employer space. So many of them like to have benefits decisions ready to go live on 1/1. So if you back up from there, then they're typically going to have open enrollment that's going to be happening in the fall. And those decisions for the benefits they're going to be offering for that calendar year would normally get made, in the summertime so that they're prepared for open enrollment and a 1/1 go live. Now, certainly decisions get made, outside of that benefits buying window. And it really kind of depends on the individual product or service that you're offering, and also how you're going to market. There are options to turn things on mid-year for different populations. So that certainly happens as well. But, kind of the ideal selling season for kind of a 1/1 go live would probably be Q1 of the previous year. But again, at this point in the year, we're working with some clients who are, actively trying to capture, some of those dollars for 1/1, and then also working with them to put together the plan and put together the
Following year, yeah.
strategy so that they're ready for the
Yeah,
following year.
yeah. So you've helped a client understand their messaging, position themselves well, who they need to sell into. You've consulted all the right people. They win this deal. Now 1/1 starts, and you now have a consumer base that needs to understand that this is available to them. What are some of the strategies on kind of expanding that partnership once it's been landed with the employer?
Yeah, absolutely. I mean, I think that the most important thing is really delivering on what you say you're going to do. And so, really setting those expectations up front around ROI, but also engagement. So, engagement and driving that engagement with the ultimate patient. So, the employee and their family, or whoever the ultimate patient may be in your scenario, is so important. And if you're unable to do that, then you're not going to be able to deliver outcomes for the service. So making sure that that patient experience is in mind when you are kind of developing the product, and really as you're going through kind of the sales process, is really important. So that's one of the key things I'd say, making sure that you're going to drive engagement, making sure that you're going to deliver outcomes, and then making sure that you are communicating the value that you are delivering as well. So, we work with a lot of companies on, what a reporting package should look like for employers, how often they should be reporting, what that looks like for them, because it goes much beyond just kind of the cost reporting. Certainly, employers are very, very focused on cost savings, but there's a lot of other qualitative metrics as well. And I think one of the big things that's unique about employers is that they very much care about the experience for their populations. So they're using benefits to drive retention and recruitment of new people, to new talent. So it's a talent retention strategy and recruitment strategy. They also just want to have a happy population that's actively utilizing the products or the benefits that they're bringing to the table.
Yeah, I mean, we get tapped all the time as kind of the digital marketing partners. You think about, okay, Cardinal helps me acquire new patients, and we'll get kind of tapped to help. Is there anything we can do in the digital space to be touching those populations, you've got an employee population and they've got internal emails and,
Mhm.
components to their communication strategy, their monthly meetings with the company, whatever it may be, to push those messages out, the cafeteria, boards. But we'll often be asked, can we have a digital component? Can we reach them on social? Can we help them
Mhm.
understand that they have these benefits? Do you hear those needs as well?
I hear that all the time. And I really think that there are a lot of things that you should do, that include marketing and beyond marketing as well. So I think that it's important to really think through how you're going to identify these people. So if you can have a targeted outreach strategy, then you can really activate your marketing in a different way with more targeted and personalized messaging. Obviously, people respond really well to that. And digital is great for that. A lot of companies that I work with too are always thinking about, how we can integrate this into benefit plan design. So when they're thinking about open enrollment and the benefits they're offering, are there different financial incentives that they can offer to employees and their families to get them to utilize the service? It's also important to make sure that it's integrated into kind of their broader benefits ecosystem and that you're aware of kind of the other benefits that are being offered and how this perhaps complements. So there are a lot of different ways you can do things, but yes, from a marketing perspective, there certainly is direct outreach. So a lot of companies, they'll do mailers to the home and things like that. But I think that there's a lot of opportunities for digital marketing to really do more to push that engagement. And I think especially a lot of the tech companies, so a lot of the health tech companies that are out there are really looking for more innovative ways to drive that engagement through digital channels.
All right, Lindsey, so to take all of these concepts and really just kind of bring them into reality, let's talk through an example of kind of what you might do or what you have done for helping a client, a healthcare client, who I'll let you kind of choose who makes the most sense, build a strategy to land some new logos in their employer contracts. And then, of course, you've got the consumer marketing side. So just give us an example of kind of how this works, what those steps look like.
Absolutely. Yeah. So we have a women's health client that we are working with, area that I have a lot of passion for. They are really trying to understand how they can grow within the employer space. There's a lot of opportunity within employers for women's health that goes maybe beyond, the traditional fertility benefits that you've typically seen. And so, for this particular company, we were really kind of going in and doing an assessment first of, again, like where they are currently, where are maybe the gaps and the easiest, kind of lowest hanging fruit areas of opportunities. And then, as mentioned, we're building out kind of that plan. So if, the goal is to, close X amount of employer opportunities over the next year and a half, for instance, how do you back into that? And one of the first things that, this particular company is looking for is really to build kind of the top of funnel. So they're a newer company that hasn't been out there for as long, and they're not, employers are not as aware of them. So we are working with this company to develop out the messaging and then campaigns where we would actually be targeting not only employers, but also, influencers in the space. So brokers, consultants, potential partners, and really developing out messaging and setting up a campaign to reach out to those individual buyers and build the pipeline. And then we're also working with this company on, what does the sales process look like to actually close these deals? So mapping out that sales process and making sure that we have the collateral, the messaging, that we understand kind of the objections and how to handle those. And then we actually a lot of time ride alongside with the customers as well. So we will support from a strategic sales support perspective as well, where we will actually get on the phone with their customers, with partners, and support throughout the sales process to hopefully, increase the likelihood of those deals closing. And we do that typically for more strategic opportunities, but it's typically a conversation with each client in terms of how deep they want us to go there.
Lindsey, it's been great having you. I want to kind of offer up any closing thoughts. I know that the landscape is changing so much on the consumer side. We're always kind of looking ahead at what's going to be like the next big focus. I don't know if there's anything you want to kind of call out as like, this is where I see our space going, to leave our listeners with that.
Yeah, I mean, I think, within the employer space where I typically work, it's become more and more crowded since there's more and more digital solutions that have come about with COVID, which makes sense. But there's a lot of different interesting solutions that are out there that could deliver a ton of value for customers. And so I think that the purchasing processes are actively changing. So employers, I think a large employer might have something like 45 different benefits that they could offer through different vendors to employees. So if you think about a small HR team, how do they manage that? So I just think that the way that companies go to market to reach employers is actively changing because this is a more crowded space. And I think there's a ton of room and demand for innovation, but you have to be smart about the way that you go to market, especially in a world where, most startup companies don't necessarily have a million different sales resources to go out there. So that's a big way that we help companies. We put together that plan and we help them execute on it.
I love it. We say the same thing on the consumer marketing side, which is you have to stand out. You have to show the value of what it is and why they should choose you. And it's just so interesting to hear, like, yeah, we're talking to different groups. We're trying to land a different type of business, but the fundamentals are the same. So I love to hear
Absolutely.
that. Lindsey,
Absolutely.
thank you so much for joining us. I'm sure we'll see you again soon. And it was great to have you. Thank you guys for listening.
Thanks, Lauren.
See you,
Appreciate it.
Lindsey.